Hi, welcome to MontrosePhysicalTherapy.com. My name is Dr. Sisson. I'm the owner and founder of Sisson Associates, and I'm just going to talk a little bit today about this website and our practice that we have here. So the whole idea behind Sisson Associates actually started for me in Lynchburg, Virginia. I was born and raised in Montrose. My family own a small farming business here in town, and I've always loved the area. So, when I went to get my doctorate in Lynchburg, and after I spent some time working in different practices up there, I came back to the Montrose area. And when I was designing, my practice, I thought about where I worked at before, the clinics. There was some things I did like, and to be honest with you, there were some things I didn't like. Before I made this practice, me and Hannah, my fiance, actually sat down and we wrote down the things that we loved when we went to different practices and things we didn't like so much. So this whole clinic is designed to be different than all the other practices down the street. From the moment individuals walk through my door here, between the lighting, the scents, and the music, everything is, I try to make it very non-medical, and I want it to be a place of healing. So the way things work in this practice is very different than the typical clinic. So basically, I only see 7 clients a day. That's it. Every client gets a full hour of my time. There's no technicians, no aides. One of the things that was on my list that I wrote months and months ago was I didn't like what I saw in a lot of clinics. Patients would come in, a hot pack would be thrown on them, and a PT would come in and see them for maybe 5 or 10 minutes, and then throw them off to an aide or technician. And I don't blame the therapist. It's more so the business models. They would have to see 4 patients every hour, so they'd have to kind of shuffle patients. They couldn't give them the time they deserved. And what I noticed was this significantly affected the time in which it took to get better. It would literally take me twice as long to get people, better and back to their jobs or sleep, off the medications. All of that stuff took me twice as long when I had so much less time. So again, the time that I have in this practice allows me to get people better quicker, and I can focus more time on something that's usually overlooked in practices due to the time constraints, which is prevention. So I can teach my clients ways to prevent the ache and pain from coming back. And that's also another thing I saw typically was clients would maybe get better, and then 2, 3, 4 weeks, pain will come back. So our focus really is on good quality care, and that leads to a quicker outcome. So that's kind of my whole practice, with a minute spiel there. But the website itself is designed specifically to empower individuals of the community. There's lots of good free information included. So I have an ebook, so a book you can download on back pain, neck pain, and knee pain. And all of these different books are things that I've written myself, and I've kind of gathered all the tips and tricks that I use most often in the clinic and kind of written it down in a book form. And that's a great tool for folks. You can download that for free. We also have a library on the website. It is jam-packed with information. So if you have any problems, you can look at that and get some help. Along with that, we have different tabs on the website that you can click on to set up free phone consultations, free taster sessions where you come in and get a little bit of help and some information on what's going on. And all of that kind of just helps folks avoid mounds of medication, avoid the creams, the gadgets, the injections, the surgeries. It's all tools to help you get better today. So I challenge you guys to check out all that stuff and see if that can help you. And I look forward to talking to you soon. Have a great day.